Hi, this is Dr. Bill Lovett from your Wellness Center. As I mentioned in part one, this is part two of a three-part series, and we're going to talk more specifically about some of the IV treatments we do here at your Wellness Center. So one of the IV drips that we commonly do is something called recovery and performance. And what this is really designed is much more towards your athletes. These are the ones that sit there and work out and maybe do some really prolonged running. They're running 50, 60, 70 miles a week, and basically they're starting to drag. And what they're doing is they're burning up certain elements in their body that really they just can't replenish as quickly as they would like. So this is really designed to basically decrease recovery time and increase performance. Our second IV therapy is called Get Up and Go. We actually use this for those individuals who really want maybe a little bit more of a metabolism boost, and those who are trying to burn fat, maybe on the weight loss programs. Those are the ones we really kind of focus, specifically the B vitamins, and really it's the trace elements that we really focus on, trying to make sure that we're doing everything we can to support basically fat burn and to boost metabolism. Immunity is probably one of our two most common IV therapies here. Immunity is really based on gearing up and boosting your immunity system, and that's exactly what it does. So understand immunity from the standpoint of, it's the B vitamins, it's the zinc, which some of you may have heard quite a bit on the internet lately, and really focus on vitamin C. And understanding that many of these IV cocktails per se that we give our patients, we can adapt them, we adjust them, we change them based on what you need or something we see that we think you can benefit from. So it's not uncommon that when we give the immunity cocktail, we actually add extra vitamin C into that cocktail to boost your immunity. Myers cocktail is probably, again, one of the top two that we use. Myers is really kind of an overall well-being type IV therapy. We actually see this more in the older generation, ones who basically are trying to stay healthy, want to live longer. I'm not going to use the word anti-aging, but certainly it will help you probably age more gracefully, would probably be the better term for it. What we do with most of these IV therapies is we basically put most of the things, at least the base contents, are very similar, and it's what we add into them that make them very different. And so what we're really adding into the Myers cocktail are those elements that really are more important as we get older to kind of support aging. Another one which is becoming much more popular is what we call NAD. It's three separate words. We just basically abbreviate it, NAD. All these things are on our website. If you want to really go look at more detail, I would encourage you to go there. But NAD really is the major role of it is to generate energy. What we call ATP, if you can remember way back in biology class, called the Krebs cycle, and how it generates ATP, which is energy in our body. It also helps manage a wide ranges of diseases, everything from diabetes clear up to cancer. Some research has been shown that it improves mental clarity, alertness, concentration, memory, and it also improves athletic performance and chronic fatigue. So NAD is really important, and we certainly are now starting to see an increased population of patients who come in specifically saying, hey, I know about NAD, I've researched it, I understand you give it, I want it. And we basically have two separate protocols we use. One a patient who may actually have some neurodegenerative type problems. Those would be more like the dementia, Alzheimer's, possibly some Parkinson's type issues. And then we have those who basically are just trying to support their aging brain. One of the things that we add in quite often is something called high dose vitamin C therapy. And again, we can put vitamin C in almost any cocktail, and many of our cocktails already come with it. It's also called ascorbic acid. And we actually will just add in extra vitamin C to kind of give people additional boost. Now everybody will say, well, can I take it by mouth? Well, you can, but you got to understand is, what do you see when you take it by mouth? You usually see a lot of vitamin C going into the toilet per se. When we give it IV, we can supersaturate your cells very quickly. And what happens then is actually a lot of vitamin C gets into the cell and less of it goes into the toilet per se. Vitamin C therapies, especially super high doses, we're talking doses up to 75 grams, using them 3 times a week, and I'm going to tell you that's a lot of vitamin C, is very common in chemotherapy centers, especially on the West Coast, and those who do alternative medicine treatments with naturopathic type physicians. This is where you have an MD or a DO oncologist associated also in line with a naturopathic physician trying to do everything they can to treat your cancer. But vitamin C has been known to help decrease bacteria inside cells, viruses inside of cells, and also help treat cancer. Hopefully that helps you. This is a synopsis. Again, in part 3, we're going to talk about how that consult looks, blood work, and how we kind of get the process started. But at least this information today, at least part 2, was pretty much a wealth of information. Much of this can be found on our website. If you want to go through it in slow motion, I would encourage you to do that. Again, this is Dr. Bill Lovett from Your Wellness Center. You can get a hold of us at yourwellnesscenter.com or also call us at 513-791-9474.